Hello, my name is Charles, and I'm an active duty Army 68 Whiskey combat medic. I want to teach you how to properly apply a tourniquet. The most common tourniquet, and the one you'll be using for this training, is the Combat Application Tourniquet, or CAT tourniquet. There are other types of tourniquets in the military system, but this is the type that you will find in your military first aid kit. Before I go over the steps of tourniquet application, I would like to explain how the tourniquet may come packaged and go over the parts of the tourniquet. First, let's remove the tourniquet from the carrying pouch and open it. The tourniquet comes packaged in the quick launch configuration, which is in a looped configuration and is good for one-handed use or self-application or applied on a casualty using both hands. The tourniquet has a large band that wraps or loops around the arm or leg. The band passes through a routing buckle, which allows the band to be pulled tight. The band is self-adhering with Velcro on one side to allow it to stick to itself once the band has been pulled tight around the arm or leg. Attached to the band is the windlass rod, the windlass clip, and the windlass safety strap. The windlass rod is turned to tighten the band around the arm or leg and is then placed in the windlass clip and secured with the safety strap. The windlass safety strap sometimes is called the time strap because it is where you write the time of application of the tourniquet. Now let's continue with the steps for tourniquet application. If the tourniquet is in the loop configuration, slide the injured arm or leg through the loop of the band, and then fasten it back onto itself as tightly as possible. The band should be tight enough that you cannot slide 3 fingers under it. It is critically important to make sure the band is as tight as possible by removing all of the slack from the band before tightening the windlass rod. Also, do not adhere the band past the windlass clip. If you're applying a tourniquet to a leg wound, it may be easier to wrap the band around the leg and through the buckle, instead of trying to slide the loop band over the foot and up the leg. Make sure to position the tourniquet above the bleeding site on the injured limb. If you can visualize the bleeding site, leave it 2 to 3 inches on the uninjured skin between the tourniquet and the wound. If there's a lot of blood and the bleeding site is not visible, place the tourniquet as high as possible on the arm or leg over the clothing. For proper application, the windlass clip and windlass rod should be situated on the outside of the body, not inside the armpit or groin area, since this will make it difficult to apply. Also, do not place the tourniquet over a knee or the elbow. Next, twist the windlass rod to tighten the band until the bleeding has stopped. Place the windlass rod inside the windlass clip to secure it. Check for a pulse in the arm on the outside of the casualty's wrist, an inch or so below the thumb pad, or in the leg on the top of the foot or behind the ankle. If the tourniquet is on properly and the blood flow has stopped, the pulse should not be palpable. The goal is to stop the bleeding within 1 minute from the time you start applying the tourniquet. Check to make sure that the bleeding has not started again and the pulse is still absent. If the bleeding has resumed or the pulse is still present, remove the windlass rod from the clip, tighten the rod into the bleeding and/or the pulse is absent, and reposition the rod back inside the clip. Secure the windlass rod and the band under the safety strap. It is always important to secure the windlass rod with the windlass safety strap before moving the casualty. The tourniquet application process should be completed within 3 minutes from start to finish. Write down the time of the tourniquet application on the windlass safety strap, and make sure to also document this on the DD 1380 Tactical Combat Casualty Care Card. If there's no other way to document the time of application, you can simply write it on the patient's forehead. When other providers arrive, inform them of your findings and treatment, and assist with evacuation as requested. Remember to continuously reassess tourniquet effectiveness every 2 to 5 minutes and adjust or tighten as needed to control bleeding. If the injury is not suited for a tourniquet, such as an injury on the back, chest, abdomen, groin, or neck, your only option would be to pack the wound and apply pressure, or wrap with a pressure dressing if one is available. If you place the tourniquet properly, it will be very tight and stop the blood flow. This will hurt, so make sure to communicate with your casualty, letting them know what you are doing and that while the tourniquet is painful, it will stop bleeding and save their life.